patients and the general public. The very nature of the virus we are dealing with makes it a challenge for frontline health workers, including us, nurses and midwives, since we and other health professionals are most at the high risk in contracting communicable diseases, including the feared COVID-19 virus, as long as we continue to be on the front line, providing essential health services and working to fight the pandemic, amongst others. Now, what is the vision of a transformed healthcare, if I may ask? A vision for a transformed healthcare system operating in our beloved country, Ghana, presupposes that we have learned our lessons coming out of this novel health situation that hits the world once in a lifetime. Yes, this is not the first time the world or parts of the world have been hit by difficult strains of diseases or epidemics. We have had the HIV/AIDS, Ebola, different virulent strains of malaria, and a cousin of COVID-19 called SARS, that is severe acute respiratory syndrome, just to mention a few. But this is the first time in recent human history where we have had a pandemic that has caused immense adverse repercussions to human resources and lives, caused economics to go into meltdowns, forced countries to enforce shutdowns, and expose the failures of modern healthcare and pathology systems worldwide. So, the vision of a transformed healthcare again presupposes that Ghana, as well as any country worldwide that has had its healthcare system exposed by this pandemic, would have learned its lessons and strive to transform its healthcare system in administration to better prepared and better poised to deal with future pandemic like situations that will hit humanities and its people rather than wallow around the confusion and perplexity leading to inexcusable high mortality rates and etc. Everyone, we all desire a near perfect, almost 100% optimal healthcare system, functioning with well-trained and well-paid health professionals, especially nurses and midwives, isn't it? Yes. Supported with right infrastructure and equipment beefed with technological advances and innovations, research and near-perfect health management systems all over the world, from the first developed countries to that of the third world least developed countries. However, we have seen how this pandemic has exposed the modern healthcare system worldwide. Here in Ghana, one of the prevalent failures was even in the shortage and eventually supply of appropriate personal protective equipment, popularly known as PPEs, to frontline health professionals like nurses and midwives. I remember during our tour as regional executive during the lockdown, we experienced a lot of complaints from our colleagues. And it was a challenging moment for us. And so as a region, we wrote to different people for sponsorship. However, it was only one person who sponsored us, and this was Mount Zion. We have also seen the inadequacy of our healthcare posts, centers, clinics, and hospitals in providing the right healthcare to persons afflicted with the COVID-19 virus. I could go on and continue mentioning specifics and how this pandemic has exposed healthcare systems worldwide. However, this is not the purpose of my discourse. What is worth stressing here is that our experiences and voices as frontline health workers and as nurses and midwives are crucial and critical in relaying to the policymakers the directions in which healthcare reforms should go in order to make improvements and deliver the transformed healthcare system that we all desire for our dear country. So, Dr. Chairman, distinguished invited guests, ladies and gentlemen, I believe I have made it substantively clear that the vision of a transformed healthcare in a post-COVID-19 world cannot be achieved without the voices of nurses and midwives. Nurses and midwives are intelligent, caring, innovative, and proactive in the management of healthcare cases, where they are positioned as teachers, leaders, patient advocates, and peacemakers. The therapeutic touch from a nurse or a midwife during care is appreciated by many patients and their relatives in our communities. And that is why some nurses or midwives are well noted to be admired by people living in our communities. They are often, nurses and midwives are often the first to detect health emergencies and work on the front lines of disease prevention and the delivery of primary health care, including promotion, prevention, treatment, and rehabilitation. Quality of care, including the quality of nursing care, is an important factor in ensuring the health of the population. Efficiency in health sector reform depends on the effectiveness of health personnel utilization. This brings to mind the cadre of nurses we have as a country. The training of enrolled or certificate nurses is still on the increase. Therefore, if we compare the number of professional nurses to that of enrolled ranks, it exceeds the norm according to the Ghana Health Services working norm, which is 1 professional nurse to 2 enrolled nurses. It is time we invest in our nurses and midwives, especially the certificate-holding nurses, NAP and NAC, in order for them to progress in their respective careers. Dr. Chair, I have taught some of them for the past 11 years, and it will surprise you to know how they are still struggling at their working places for steady leave with pay. Meanwhile, they are very intelligent and they can do a lot of things when giving higher certificates. Mr. Chairman, ladies and gentlemen, how many of us paid attention to a cholera outbreak we experienced during the COVID-19 lockdown last year? How many of us? Be thinking through. Were there mortalities as a result of cholera outbreak? Perhaps the absence of these mortalities could be due to the strict adherence to frequent hand washing, while every attempt was made to ensure the cleanliness of whatever we consumed during this era of COVID-19. COVID-19 protocols of hand washing and wearing of masks is already a way of life for nurses and midwives at the workplace. Long ago, before the onset of this deadly pandemic, let everyone continue to wash their hands even after COVID, and the rate of communicable diseases will see a decline in the post-COVID-19 world. In conclusion, if you are here as a nurse or a midwife listening to me today, note that you have chosen the right profession, and for that matter, you are a stakeholder in the decision-making process towards the transformation of healthcare administration systems within the health sector. As we all know, where there are no doctors, there are always nurses and midwives. However, being a nurse or a midwife goes beyond the wearing of a uniform. Professionalism in nursing means providing top quality care to patients, while also upholding the values of accountability, respect, and integrity. In terms of accountability, your years must be your years, and where you commit errors, you need to be accountable to it. That is why in our professional code of conduct, if you are busy and you have assigned a junior ranking person to do something whilst you are in charge, you need to have time to supervise the success of the procedure you have assigned to your junior colleague. And when it comes to respect, respect is a human being. You cannot call any other thing by any name or a pet name, and you think you can refer to a human being as a pet. Your name is your name, isn't it? And when it comes to integrity, ladies and gentlemen and colleagues of the noble profession, we can adopt Myra Levine's principle of conservation. Myra Levine is one of our nursing theorists who has had the principle that we need to conserve certain things about the people we care for. One of them is to conserve the energy. But I want to concentrate on integrity because I have mentioned integrity. You can look at conserving the patient's integrity in three dynamics. It can be the preservation of the integrity of the person, that is personal integrity, the social integrity of the person, and the structural integrity of the patient. In restoring the personal integrity of the patient, it means that the patient's sense of identity and self-worth must be acknowledged. You need to acknowledge the uniqueness and social integrity of the person. That is why you cannot say bed 1 whilst on the ward. Mention the person's name by his or her name. You cannot say the diabetic patient. No, it doesn't ensure integrity, neither in the personal way, the structural way, or the social way. And socially, we have our significant others who care or who matter in the early recovery of our conditions. Therefore, let us be nice to everybody. It does not matter whether rich or poor, where we give room for people we perceive to be rich to visit their patients at the odd hours, and we shun those we think they are not rich. Always remember, you have to work with integrity. This phenomenon called COVID-19 or coronavirus is just but a phase that our world will go through. It shall come to pass together with its many variants. There is light at the end of the tunnel. Healthcare delivery in the post-COVID-19 world can only be better and much ahead better positioned by its experiences, bearing the scars of the COVID experiences, economic losses, human fatalities, and shutdowns in our way of life as never experienced before in the living history. It can only get better, and on the threshold of improved healthcare, the nurses and midwives, and not, it can, sorry, let me take that again. The healthcare delivery in the post-COVID-19 world can only be better and much better ahead positioned by its experiences, bearing the scars of COVID-19 experiences, economic losses, human fatalities, and shutdowns in our way of life as never experienced before in the living history. It can only get better, and who best are the ones to lead the way, if not the voices on the ground? On the threshold of improved healthcare, the nurses and midwives, not only in Ghana, but all around the world. Unity is strength. Unity is strength. Unity is strength. Long live GRNMA. Long live Ghana. Thank you.